Hi, welcome to the GHAP Archive. My name is Daniel Shirelli, and I am the director of Columbia's Gay Health Advocacy Project. By the early 1980s, the HIV/AIDS epidemic was growing at a rate that far exceeded people's knowledge about how the virus was transmitted. At Columbia, administrators were starting to question whether or not it would be okay for students who were afflicted with AIDS to share space with other students in dormitories and on campus. And students themselves were really concerned and scared about whether or not they might have the infection or how they might prevent themselves from getting the infection. Students in high-risk groups in particular were committed to learning more about HIV and to working to advocate for their own rights and their own health. In 1985, Laura Pinsky, who was a therapist at the counseling service at Columbia Health, as well as a graduate student named Paul Harding Douglas, started a group called CU-GHAP at that point in time. They recruited students from across campus who were committed to formalizing, learning more information about HIV, and they built relationships with researchers in the city and across the world who were also at the cutting edge of HIV research in order to gather information and to support people on campus. They ended up producing a book called the Essential HIV/AIDS Fact Book, which sold hundreds of thousands of copies and was a resource for many lay people in the United States around HIV. GHAP eventually became the first group in the country on a college campus to offer HIV testing. An important part of GHAP is that we've always connected people to excellent care and resources in the city as well. It was important that students who were concerned would have the space and time to meet with advocates or counselors who would listen to them and be compassionate about what their concerns were, give them honest information, and support them through the process of getting tested and potentially having a diagnosis and beginning treatment. As our knowledge about HIV improved, and especially as treatments for HIV have come to the fore and become so effective, we've expanded our mission to talk about other sexual health information, but we continue to use compassion and think holistically about students' needs. In particular, starting in 2014, we've had a program for PrEP, or pre-exposure prophylaxis, and expanded our services as well to talk about birth control education for anyone who's interested. I welcome you to have a look at the information on this archive site, where you can learn more about the history of GHAP and HIV and AIDS on this campus. And then you can also go to our current website to learn about our current services at GHAP and how you can access them.